So once we've assessed and we've asked what matters, we need to go a little bit deeper to really understand some of the impediments to joy, which again can vary by context. So here's some of the things that you might find. Some barriers to joy might include concerns about your physical safety. We know that healthcare workers, particularly nurses, have very high rates of acute and chronic musculoskeletal injuries, high exposures to bloodborne pathogens and other infections. And across the nation, we're seeing increased incidences of unnecessary and unfortunate gun violence. So are any of these physical threats an issue in your environment? When somebody leaves at the end of their shift and it's dark and they're walking to their car, do they feel safe? And do they feel like adequate precautions have been taken to protect them? Psychological safety. Do people feel safe to ask questions, to speak up, to admit that they've made a mistake? Are people safe from bullying or harassment? We'd like to think that that doesn't happen in healthcare settings, but I know some of us have witnessed that. Equity. Do people feel that their work environment is fair and just? And that could be anything from pay, equal pay, to promotions, but also just feeling like their voice is heard as much as the person next to them. Camaraderie. Do people feel like they're part of a team, part of something bigger? Do people feel like they have some choice in how they execute on their daily responsibilities? And ultimately, do people have meaning in their work? Do they feel connected to that higher purpose? So as Derek pointed out, the relationship to Maslow's hierarchy of needs, others have plotted these against that hierarchy. And what this reminds us is that the things at that base of the pyramid, sometimes that represents first things first. And so if we don't first attend to things like physical and psychological safety, we may not be able to help people get to connection to meaning.